It's been a long-term problem really, but recently it's become more of a problem where it's affected me daily. I'm a busy mom of 3 and I was avoiding picking up my children, I was avoiding getting down to their level. So yeah, it was impacting on every aspect of my life really.
Back pain is a very common problem. About 70% of the population will suffer from this problem at some stage in their life. Most common problem is a simple mechanical back pain. It can be the muscles, sometimes the ligaments, small joints in the back. Nowadays we advise the early management, early attention.
Most people get very worried about back pain, but most back pain is not serious. Very painful, just not serious. The key to any successful treatment is movement, but at a pace that you can manage. So if your pain level will come in at, say, 15 minutes of an activity, stop at 10. Keep mixing it up and keep yourself as comfortable as you can.
When I went to see the physio, we compiled together sort of an exercise plan which I found which I could do, and then started off with gentle exercise and then moved on up to more strenuous exercise. It was nice that I felt I was doing something for myself, to be told that there was something that I could do about my condition. It was going to have to be me that did it.
I had been suffering from my back, very severe pain in the back. I would refer to have something done about it. The instruction and the teaching that I've had since I've been there has given me something that I can control myself.
Your physiotherapist may well give you a couple of small exercises in order to help the process along a little bit. 3 that I give as a general rule are knees to chest, so lying comfortably on your back, you just bring your knees towards your chest to where it starts to get uncomfortable, release to arm's length, and then just gently and smoothly repeat the process. This puts a little bit of movement into the back, allowing you to bend more comfortably. The second one, still lying on your back with your knees bent and your feet flat on the couch. You then roll your knees from side to side. This then allows you to put some sideways movement into your back in order to get you to allow you to twist more comfortably. Another exercise I give then can be done frequently through the day to work the core stability muscles, which are the muscles deep around the spine, which help support the spine, is just from a slump position, using the lower tummy muscles, you just bring your hips forwards until you get into good posture, relax into that, hold it for a few seconds, move out of position, repeat that 2 or 3 times, and that will work the muscles and keep them ticking over while your activity levels are reduced. Returning to fitness is a gradual process, but you will be able to see improvements along the way.
I used to notice it when I'd done bending down, gardening mainly, because of lifting as well. Eventually I went to the doctors and then I saw a physiotherapist. I faithfully did the exercises twice a day, and the lower back pain hasn't come back as yet, although I'm still very conscious of when I'm bending down. The work I do, I sit at a desk for hours on end, which is a real struggle when you are in pain. Definitely, since the pain has decreased, it certainly has been easier to carry on with my work.
We give you the advice, we give you the exercises, we give you the painkillers, but it is your back and it is up to you.
The best exercise for you is one that you enjoy. It can also be anything: housework, gardening, all of these, walking up and down the stairs when your level is that low because of the intensity of the pain.
I think the exercises have helped, although I'm continuing to do them, although it's once a day now instead of the twice a day.
I would encourage anyone that is suffering to seek these type of advice and refrain them from seeing their doctors.
Now I don't think twice about things that I used to, like picking up the children, and generally life is 100% better.